Hello everyone, and welcome to another of our live stream videos today. Thank you for joining me this afternoon. I'm Dr. Rachel Zabana. I'm one of the pediatricians at Hoag Medical Group. I'm located in the Foothill Ranch office. And tonight we're going to be talking about becoming a family. We're going to go through some tips for expectant and new parents on what to expect and what we can do in preparation for our brand new babies. And congratulations. So let's start. And I do need to mention, during the presentation, if you have any questions, please feel free to type them in, and we'll try and go over them, as many as I can at the Q&A session after the presentation. Okay? So first things first, what happens when you're at the hospital? At Hoag Medical Group, at Hoag, we have two hospitals right now. We have our Hoag Hospital at Irvine and Hoag Hospital at Newport Beach. Because of COVID, it's hard to do in-person visits but we have virtual videos to check out the hospitals and go through what a normal day would be, what you can expect, what the hospital looks like, and what the unit looks like. And you can find that on our websites at hoag.org. So, the delivery room. At the delivery room, a few things are going to happen. One, the most important thing is initiation of breastfeeding. That's the golden hour, right after the baby's born. Putting the baby skin to skin and starting the breastfeeding is a great way to welcome the baby and comfort the mom. There's a few other things that the baby's going to go through right after birth, after they're stimulated and wrapped and given to mom. We're going to give them the antibiotic eye ointment. And that one is to protect them from from certain STDs that they may pick up on the way out of the vaginal canal. The other thing is the vitamin K injection, and the reason for that is babies do need the vitamin K to help with clotting. The babies in the first few months, first of all, the liver is not working as well. It's still kind of waking up, and that's one of the places where vitamin K is actually made. It's one of the cascades, one of the things that we need during the cascade to control clotting, normal clotting pattern. The other thing is breast milk doesn't have as much vitamin K in it, and babies do not start eating foods until 6 months of age, and so from birth until 6 months, we want to protect them. So giving them the vitamin K injection would be a great idea. Hepatitis B vaccine is the other thing that we recommend at delivery. It is to protect the baby from transmission of hepatitis B infection from mother to baby. And it does sound like we're putting a lot of pressure on mom, but these are all measures, standard of care, meant for everyone. It is not to make mom feel uncomfortable or to point anything out. It's more as a standard measure to protect everyone regardless. You never know what's happening. So let's go on to the next one. What happens once you're in your room with the baby? So for the hospital stay, there's a few things that are going to happen while you're in there. For C-sections, the babies tend to be with their mom for about 3 to 4 days before discharge. For vaginal deliveries, it's about 1 to 2 days, depending on how comfortable the mom and the babies and the family is. Every day you're there, the pediatrician who's on call will be rounding on the baby, will do their exam of the baby every day. You're also going to receive some lactation assistance from the nursing staff. We also have a lactation team that is an excellent source for mothers when it comes to breastfeeding support. The other thing we're going to do every day is daily weights and doing the baby's vitals to make sure that the baby's progressing the way we want them to. The baby's going to have some screening tests towards the discharge time. One of them is the hearing screen. The hearing screen is very simple to do. Some babies may fail the first time, but not to worry. Sometimes there's a little bit of fluid, amniotic fluid still stuck in the canal as the baby was being born. It may have gotten some in there. It takes time for that to resolve. So we will be repeating that again before discharge. If they fail again, not to worry. Our team will set an appointment as an outpatient to make sure that we follow through with that. This is one of the important tests to do because hearing is one of the most important things when it comes to development of language and social skills, and it is something you don't want to miss on a baby. Cardiac screening is the other one, and that one looks for congenital cardiac disease. It's very simple, it's non-invasive, it's basically checking for pulses from different locations of the body to make sure that the baby doesn't have any abnormalities that we can catch in the first few days before you go home. Metabolic Screen is the other one. That one actually goes to our newborn screen center down in San Diego, and that one looks for metabolic and inborn errors of metabolism that the baby may have that may go unnoticed in the first few days, but it's extremely important to pick up because we can either halt or minimize the detrimental effects or hopefully prevent some of them. Every state has different tests that they test for, but overall most states will test for the most important things. I believe California has a test for the most, for a lot more overall screening than other states, only because California tends to have a lot more different varieties of people and different backgrounds. The next thing is bilirubin checks. Bilirubin is a byproduct of red cells. When you break down a red cell, you release bilirubin. Bilirubin is the reason that our urine and our stool are the color that they are. They can also, if you have enough bilirubin running around in your body, it can actually deposit under the skin, and you'll have that dark yellow look. Sorry, not dark, yellowish look that the babies have. We expect babies to have a little bit of bilirubin building up as part of every newborn. There's different reasons for it. One of the main reasons is the liver, again, is still kind of waking up. It's not realizing what it's supposed to do. The liver is where the bilirubin is broken down and moved along to be excreted through the urine and the stool. So one way to enhance that excretion is to get the baby to eat. So feeding, pooping and peeing, that's our biggest goal, to get rid of that bilirubin. Another way to do that is through indirect sunlight. So I usually tell people when you're breastfeeding, sit by a window, get some indirect sunlight. No cooking the baby in the middle of the heat, in the middle of the summer outside. It's just open up the drapes, let some sunshine in. That helps to kind of help in the excretion of bilirubin as well, but it also gives you some vitamin D from the sun that we naturally will get for mom and for baby. And also it's actually a great way for to help with mood. Sunlight, at least 15 to 20 minutes a day, is very vital for somebody's mood, so that helps mommy as well as the baby. The bilirubin is checked in the nursery in a couple of ways. The one we go to first is non-invasive. It's using a billimeter, which is actually a little bit of a machine that we touch the skin, usually at the forehead or the chest, but most of us will use the forehead. And it's basically infrared, and it measures the bilirubin under the skin. It's fairly equal to the serum when we draw a blood test on the baby. It should be pretty equal. Sometimes it can be a little bit off by 1 or 2 points. The reason we do that is because we want to know where that bilirubin level is, and if it's climbing or if it's plateauing or if it's coming down. If it's climbing too fast, we need to keep an eye on that. We need to make sure, worst case scenario, the baby may need some phototherapy. In terms of treatment. We do not want the bilirubin to be too high because that has some detrimental effects if it got to the serious levels. But in general, most babies do really well. We expect the bilirubin, like I said, to come up just slightly in the beginning, and it will go down on its own. If we are worried, we will definitely do a serum test, which is a blood test. They just poke the heel of the baby, and we send that to the lab, and we measure that, and we follow it. If you happen to be a male baby, I would highly recommend parents talk about circumcisions and whether you want to do it or not ahead of time, so you have a plan and you're not bombarded by too many things. Generally, we like to do the circumcisions in the hospital before you are discharged home. One is because it's done in the hospital. We have the facility. We monitor the baby after, and then by the time you go home, everything is nice and done, and all you need to do is just continue the care post-circumcision, which is mainly putting a lot of Vaseline on the area and keeping it nice and protected by diapering the baby. It depends on the physician. There are 2 methods to do the circumcision, and it depends on the pediatrician and their training and what they're comfortable with. Most people, when it comes to circumcision, it ends up being, in the end, more of a preference. It's either a cultural reason, a religious reason, a family preference. Dad has it, therefore they want daddy and all the boys to look the same, things like that. When it comes to AAP, the American Academy of Pediatrics, the recommendations have been sort of neutral. There is some evidence that children who are circumcised, or people who are circumcised, they have just slightly less chance of getting urinary tract infections. There is a decrease in sexually transmitted infections. One of them is HPV, because HPV actually likes to stick to the foreskin. So that's, and of course, HIV is another one. But you know, it's not a big difference, but it is a difference. The other thing that people might want to think about is cancer of the penis. People who are circumcised are less likely to have certain cancers of the penis. In that sense, it's up to you. If you have any questions, I do highly recommend you talk to your doctor. Before we do any procedures at the hospital, we do, of course, speak to the parents. We explain the entire procedure, and we talk about any possible complications or side effects that you need to worry about. One of the other things we do from the moment that the baby arrives in the nursery is start with the discharge planning. The idea behind that is not so much to let's hurry up and get you out of here. It is more of let's start planning from now, so that nothing is last minute, nothing is a surprise at the end of the day, and it makes everything more comfortable, and it allows the parents to ask questions that they may not think of until after all of this is done and dusted and they're already at home. We do generally like to see the babies in our office about 2 to 3 days after discharge. If it happens to be on a weekend, or you're being discharged on a Friday or a Saturday and you need to be seen before Monday, we do have, at Hoag Medical Group, we do have 2 of our offices that are open on the weekends basically for things like this, and for just to be in general available for our patients. It is half day, and it works great for newborns that need to be seen but can't wait till Monday. So let's move on to the next one. So what happens when you actually get to the doctor's office for your well baby checks? In the beginning, in the first year or so, you do have a lot of visits, and as the baby gets older, the visits get less and less, and by the time you're 3 years old, we only see you once a year. The reason for that is in the first couple of years of life, that's when most of the development happens, and it happens fast, and there are certain times in development that we need to make sure that the baby hits certain milestones and doesn't fall behind. So every time you come in for a well visit, pretty much all of these areas are going to be covered. We're going to do a physical exam. We're going to talk about the baby's behavior, development. Behavior includes temper tantrums when you're about 18 months to 2 years. You can have stranger anxiety between 18 to 24 months. You can have temper tantrums at 3 years old. We expect babies that are 4 months old to be to start doing the raspberries and kind of spit, and they can start drooling. Babies at 2 months old should be cooing. Baby that's at 9 months old should be saying something, at least some sort of vowel like mama or dada in any way or shape or form. If there are red flags that we look for, and these are the visits are very important to catch those. One of the red flags is, for example, if a baby has not made a sound and he's 9 months old, the first thing you want to think of is, can this baby hear? Is there a mild deficit that's interfering, and that's why the baby's acting like he doesn't know you're even there, or he's acting like, quote unquote, possibly autism? You need to make sure this is not a baby who can't hear you. The other thing is, another reason for these visits is checking and looking for any possible mild deficits that can trigger us to think about possible autism, learning disabilities, vision problems, or just growth in general. They're not growing, they're not eating. These visits are also very important for premature babies, especially when it comes to nutrition and growth. And of course, for all babies, we talk about safety, and for all babies, we talk about general health and immunizations. I did want to mention one thing. For premature babies, they are pretty healthy. We do expect premature babies, and these are late premature babies, the ones that are like 34, 35, 36 weeks, who are completely healthy. We do expect them to catch up at the same time or close to the same time as a full-term baby. We don't want to say, oh, he's premature, that's why he's not speaking yet. That is a baby you want to jump on and find out what's going on and why he's not meeting these developmental milestones. The other thing is, when it comes to vaccines, for preemies, for premature babies, you don't want to wait. Again, their immune system is even more immature than a full-term baby, so we don't want to wait until some people try to correct the age and say, oh, since the baby was born 2 months too early, I have to wait 2 more months in order to start vaccines. That is not the case. You want to start from the moment the baby's out of the womb. That's the age you want to follow when it comes to when is the baby supposed to vaccinate. It's supposed to vaccinate exactly the same way as a full-term baby. The only time we do correct for the prematurity is when we're graphing the baby on a growth chart, because a preterm baby may not be the same size as a big baby, and they're going to grow at a different rate, and they have their own graphs that we can follow. Once they hit 2 years old and older, that goes away, and we graph them normally just like everybody else. Okay, so when it comes to growth, the first 6 months to a year, you're going to see the biggest bursts of growth. Length tends to grow the most within the first 6 months of life. Overall, you grow about an average of 0.7 inches per month, which comes out to be between half an inch to an inch, depending on the baby. Some babies may grow a little bit faster. Hopefully not too fast, because that is not, we don't want anything too fast. The body doesn't like too fast. It likes nice and stable, nice patterns. By the first birthday, the baby's length will be 1.5 times the birth length. When it comes to weight, on average, you're supposed to gain about 1.5 to 2 pounds per month. That actually comes out to be, it depends how you break it down. Some people like to break it down by day, by week, by months. By day, and I don't recommend weighing the baby every day. It will change because the baby's going to poop and they're going to lose weight because the poop is heavy. And then they're going to gain weight right after you feed them. But overall, they're supposed to gain about 1 ounce to 2 ounces a day. Overall, about 1.5 to 2 pounds per month. The first birthday, the weight should triple from birth weight. And we do expect babies in the first week of life to lose weight before they gain weight. They should lose a lot of the water weight, basically. And they usually lose no more than 10% of the weight. They should plateau around days 5 to 7, and then after that they should start gaining weight. Preterm babies can take up to 2 weeks to reach birth weight, and term babies between 7 to 10 days, up to 2 weeks sometimes. But this is why we do want to see the baby on the first 2 to 3 days after discharge, and then again the next visit will be at 2 weeks of age to make sure that that baby has reached the goal, and then go from there. So let's see. The head circumference does grow as well. Our aim is head length, weight, and head circumference. The baby should be around symmetrical. And patterns are really helpful in seeing how babies are growing. So to grow, you need to eat. So let's talk about feedings. Breast is best, of course. There are a lot of benefits for the baby and the mom when it comes to breastfeeding. And of course, for the baby, it's the nutrition. It's got all of the nutrients. It has all of the antibodies. For the mother, it actually helps when you're breastfeeding. It actually releases oxytocin and actually helps to tighten the uterus. And it helps with decreasing the postpartum bleeding. It also helps with mom's mood. Breastfeeding moms who are having a good experience with breastfeeding tend to have less postpartum depression. They have a better bonding with the baby. The baby's well-being is actually better. And there are some, studies that are showing that possibly the IQ is actually a little bit higher for babies who are breastfeeding. There's also decreased SIDS risk with breastfed babies. They're less likely to have infections, and if they do, like diarrhea, upper respiratory infections, coughs and colds, but if they do get sick, the length of infection is a little bit shorter, and they tend to be less likely to end up in the ER or admission for being very sick when they're breastfed. Having said that, it does take a while for mom and baby to kind of mesh together and to get that breastfeeding established. But the most important thing is not to discourage mom and not to push mom too much. It is natural to breastfeed, but it does take time, it does take some effort, and it does, a mom does need to kind of have little breaks. She needs to be reminded that she has to eat and sleep and take a break. Just like any job, you have to take a break. The other thing is, reminding mom that she's doing a good job, just a couple of good words here and there, and lots of fluids and nutrition for mom in order to be able to produce milk, to be able to have the energy and to recover herself. So breast milk, and there's colostrum, which is the first few days you're going to get that colostrum. A lot of people get really worried that the colostrum is too little, it's not good enough, we need to give formula. Not necessarily. Colostrum is low volume, but it is packed with a lot of goodness. It has it's the equivalent of a lot of calories in an ounce of breast milk. It tends to be, it tends to be darker in color. It's more yellow, and it's a little bit thicker. It actually has a lot more nutrients. It's very high in protein, a lot higher in the antibodies and any immunologic components that helps to fight infection. It is lower in carbohydrates and fat, but it's because, think of it this way, proteins are made up of amino acids. Amino acids are the building blocks of our body, so you need that first in order to make a foundation. And then I'll give you the carbohydrates and fats to build on top of that. That's one way I think about it, but that's pretty much how it is. You need all the proteins, and you need all the immunologic benefits in order to survive as the breast milk comes down. Breast milk letdown happens around, depending on the mom, most people between 5 to 7 days. Some people, it happens 3 to 5 days, but by 5 days, you should start feeling that the milk is coming down. The more you put the baby on the breast, the better, because it is signaling your body, and it's telling the body that, look, there's a baby, he's looking for food, we need to get some more work done here, come on, let's go. So the more you put the baby on the breast, the better. And it helps with bonding too. It helps you establish it better. If you have any problems with breastfeeding, we have the lactation team at the hospital. We do have lactation we have a lactation team that works out, that you can have appointments with as an outpatient. And we also have the Pacify app, which is a great app to have. It actually is, I believe it's 24/7 access to lactation team, and it does one-on-one online, which is a great way for, especially during COVID times when it's a little bit scary, if you're worried at all, to go outside and have in-person visits with a lactation team. The other thing is when the breast milk does come in, it tends to look more creamy and whiter. in color. It is higher in fat, higher in carbs, carbohydrates. It is a little bit lower in protein, but there is protein in there. It still has some antibodies in there and all the other nutrients as well. And when the milk letdown starts happening, most moms will start feeling that the breasts are getting fuller. One way, if you want to think of it this way, a lot of moms worry that the baby didn't get enough. If your breasts feel engorged and after you're done breastfeeding, they feel like they're empty, that is an excellent feed. I did put one slide. Oh, let me add one more thing. When it comes to newborns, we do expect them to eat a lot, especially in the beginning. Some babies are born right on the dot. They only want to eat 3 hours, every 3 hours. Beautiful schedule. That's the way they are. Some babies like to nibble all day long and use mommy as a pacifier. But overall, most kids will feed about 8 to 12 times a day, which comes out to be every 2 to 3 hours a day. The main thing, there's no hard and fast rule, but the easiest way to remember is if the baby has not woken up to feed and it's been 3 hours, it's time to feed that baby, especially at night when everybody's exhausted and sleepy. Even the baby, they're still recovering from the birthing process as well. We may need to kind of push them a little bit in the beginning. If the baby's not waking up to feed and you're having a harder and harder time, we definitely need to know about that, because it could be that the baby needs more food. It needs to be evaluated. We need to make sure the baby knows how to suck. Or it could be that the mom's milk is not coming in for one reason or another. Stress would be a big, major thing for that kind of hinders mom when it comes to breastfeeding. Stress does terrible things to everybody, to all of our body in general. So no stress. We want mommy nice and happy and comfy and very well hydrated, so that we can work on happy breastfeeding experience. I did not put in the lactation team's phone number for Hogue, but you can find it on our website. But it's an easy number to remember. I'll just mention it. It's 949-764-BABY, B-A-B-Y. The Pacify app you can download, but I do download and register. But I believe if you're born at one of our Hogue facilities, you will get that as part of your discharge sort of packet. And of course, pediatricians are here. We are here to help with anything. If you need more lactation support, or if for some reason you want a different way, a different route, there are private lactation offices as well around us that we can recommend. Let's see what's next. So how do you know if you're making enough milk? And why is it okay for colostrum to be that little? So I put this picture. It's the nicest way that I can view in my head to kind of keep in mind that we're not overfeeding the baby or we're not underfeeding the baby. And the other way to look at it is if you look at the baby's fist, that's how big their belly is. So you can imagine if you're trying to feed a baby 3 ounces of milk and the baby's hand is like, the wrist is like this little, it's gonna come right back and the baby's gonna vomit and you're gonna have some reflux issues or what looks like reflux issues. Most babies do reflux and that's a normal thing, but not to the point that they're uncomfortable, crying, losing weight, vomiting, most of their feeds. That's a different way. But the answer when it comes to, am I making enough milk? The answer is always yes. And the other issue is it's supply and demand. If you're putting the baby on the breast, the body's going to make more breast milk. If you're not, and there's a sort of a disconnect, for a better lack of better terms. If you're not meshing together with the baby and the baby's uncomfortable, mom's uncomfortable, it can affect the breastfeeding. And again, lactation team is here to help us with that. By the end of the first week, you're supposed to, the baby is supposed to take about 3 to 4 ounces every feeding. And again, these are not hard and fast rules. These are just guides. And by 6 months, babies will be taking about 6 ounces, overall about 4 to 5 feeds a day. In the beginning, in the first couple of months, we do want you to wake up the baby every 3 hours. Like I said, as the baby gets older, they can sleep longer and longer during the night. Okay, let's go to the next one. All right, diapering, or wet diapers. How many diapers should the baby have, and how many poops should the baby have? Wet diapers and dirty diapers. So in general, we need to make sure the baby pees by the first 24 hours of life. And poo, we can take up to 2 days, but we definitely need to poo within the first 2 days of life. One way to remember how many wet diapers should a baby have, think of it this way. Day 1 urine. Day 2 wet diapers. Day 3 wet diapers, and so on. Once you hit 5 days, minimum 5 to however many. Most babies, once they get the hang of it and the milk letdown happens, around 5 to 7 days, they should be pooping and having a wet diaper almost every time you put them on the breast, and once they feed. With formula-fed babies, the poops are thicker. They are darker. They could be a little bigger, bigger bowel movements, but overall should be pretty much the same in the end. The growth should be the same. The feedings should be the same. There. And sleep. Babies are going to sleep a lot in the beginning. They will sleep on average about 16 to 18 hours a day. Babies don't know the difference between night and day, so a lot of times babies will switch their rhythm, and they'll be more awake at night and sleep all day, and it kind of throws off the parents because mom's trying to get some sleep before she goes to work the next day. But overall, by the time they're 3 months old, they will have about 6 to 8 hours of sleep without waking during the nighttime. At night, when the baby's crying, or in general, when the baby's crying, you can go through that little list, a checklist in your head. Are they hungry? Do they need to change diapers? Is it too hot? Is it too cold? Is their tummy hurting? Are they passing gas? Do they want to burp? Things. So every time you hear the baby, doesn't mean that they're sad or in pain. It could be one of those. When in doubt, and they're about 3 to 4 months and they're starting to drool, it could be teething. So if you rub their gums and they smile at you and they stop crying, that's probably what it is. It's teething pains. Doesn't mean they're going to get their teeth right then and there, but it's the process is beginning, and the gums are swelling and they're feeling irritated. We don't recommend sleep training or crying it out until at least 4 months old. And and the other thing is, I always mention to parents, make sure the baby's feeding enough during the day so that you are able to let them sleep through the night. So, best sleeping practices. Most babies these days tend to have a little bit of flatness on the back of their head because we tell everybody babies are back to sleep. We want to swaddle them really well and let them sleep on their back. It helps to reduce SIDS and it keeps them safe. The other thing you want to make sure is nothing in the crib. It should be a nice mattress that's firm. There should be nothing else in there. No pillows, no cushions, no teddy bears, nothing that can somehow cause the baby to get tangled in or have them flip over. We don't want you to put the baby on the side because the baby can flip over. There are all these new things that you can put in the bed to make the baby more comfortable and sleep on their side, and all of those pillows. Talk to your pediatrician before you do all those, especially in the first couple of months, especially until the baby is out of that SIDS risk, which is but the highest risk is, I think, is about 4 to 6 months. It starts weaning off because the baby starts learning how to flip over, and then we can talk about that. Avoid over wrapping the baby when they're asleep because they will overheat and they will look like they're having a fever and they will be miserable. So if you're not sure if the baby's cold or hot, look at yourself. If you're cold, they're cold. If you're hot, they're hot. The other thing is, when it comes to, when we're talking about SIDS, is breastfeeding does help lessen the SIDS chance. And the other one is immunizations. Immunizing the baby and immunizing them, oh my goodness, and giving them their vaccines at the right schedule has been shown to decrease SIDS risk. One thing that will increase SIDS risk is smoking. So hopefully nobody's doing that anymore, or less, I hope. Room sharing, we don't recommend until 6 months of age. Lastly, I know there's a lot of new technology that's coming out there on Amazon and other websites and other places that are to monitor the baby through the night. Talk to your pediatricians before you start buying these things, because some of them may be good, but some may actually cause a lot more stress on the family than the benefit they're supposed to be giving. Having said that, I did have a couple of babies that had the outlet sock, and we were able to pick up fast heartbeats, but it just happened to work for those two babies. But I would still talk to the pediatrician before you do that. Of course, baby monitors, so you can watch the baby and hear the baby while they're asleep. That's great, but things. Cardiorespiratory monitors, heart monitors, apnea monitors, talk to your pediatrician, because sometimes if they're not placed properly, if they're not working properly, if the Wi-Fi is off, it may beep for no reason, and it'll just distract you. It will not allow the baby to sleep properly. It kind of interferes. So talk to your doctors before you do that. Lastly, the last thing is co-sleeping. Room sharing, but not co-sleeping in the same bed. That's very important. And after 6 months, you can put the baby in a different room with a monitor to watch them. So fevers. Fevers versus warm. Fever is 100.4 or higher in a baby. If you overwrap the baby, you can raise their temperature and they can look like they have a fever. So if the baby's sleeping and comfortable, and if he feels really warm or she feels really warm, unwrap the baby, give them a few 10 seconds or so, and then check the temperature again. If it has gone down, you've overwrapped the baby. Check the room temperature. It should be a little bit cooler. Temperatures of about 68 to 72 degrees are ideal for the room for the baby. Dressing the baby. If you're cold, they're cold. If you're hot, they're hot. So if you're wearing 3 layers and it's freezing outside, give the baby 4 layers. That's the only time we say add 1 when it's cold. If it's hot outside, it's 100 degrees outside, and you're wearing 1 t-shirt and you're sweating, don't wrap the baby with 4 wraps because that baby's gonna get hot. And the other thing that babies will have, especially at night, they tend to sound nasally and congested. That is normal. You can use some nasal saline drops and suction the baby's nose. That helps. But if they're comfortable and they're kind of noisy, that's fine. They make a lot of noises when they're asleep too, grunting, kind of moaning, that kind of thing. As long as they're healthy and happy and they look comfortable, they're peeing and pooping, it's all part of being normal. Sometimes they will have what's called periodic breathing. Well, they'll stop breathing. It looks like they stopped breathing for a few seconds, up to 15 to 20 seconds without color change, without any other abnormality. That's normal. And usually they'll stop breathing, and then all of a sudden they'll take a really quick breath and a few shallow breaths right after that, and then it'll go back to normal. Absolutely normal. It can happen all the way up to 6 months, and then it will fade away. And these are for healthy newborn babies. If you're worried at all, always bring it up to the doctors. Babies always tend to have different types of rashes, heat rashes, they can have acne, baby acne. It's not necessarily the same pathway or same reasoning as the acne you get as an adult, but babies get all sorts of pimples and rashes that will fade away over time. Most of them are absolutely normal. Some show up at the 2nd or 3rd day of life, some show up a couple of weeks later. We can talk about any of those and all of those at the visits or before. Just give us a call. Cocooning, especially with COVID, what's going on today, everybody's kind of a little bit worried about keeping the baby safe. One way is cocooning the baby. This is a baby with immature immunity. They may not be able to get certain vaccines yet. They're not ready for the vaccines until 2 months of age, or 6 weeks is the earliest. So whoever is going to be around the baby, taking care of the baby, we want to protect those people so they can protect the baby. So moms, we get them every time. Before they leave the hospital, we give them the Tdap, we give them the flu shot when it's the flu season, we make sure the Prevnar is up to date. And nowadays, thank you, with the COVID vaccine, we can offer that as well. For the elderly, you want to make sure they're up to date on all of those as well, including the shingles vaccine. And hopefully most of us are getting vaccinated and will continue to get vaccinated. Vaccines are safe and they are effective. I know there's a lot of myths out there and there's a lot of questions out there. Babies are not too young for vaccines. Vaccines do not overwhelm the system. You are getting about 0.5 milliliters per vaccine. So that's like a drop in a big bucket. And if you have any questions, please talk to the doctors well before so you can get the right information and get to the right websites. Babies' immune system is mature. That makes them more vulnerable to infection, which is why we want to give them the vaccines, to boost their immune system a bit faster without having them go through some of those infections and get sick from them and have to go through the whole system like we did when we were younger. And the other thing is, most of us have gotten these vaccines and earlier versions of these vaccines, and we are fine. It's a lot more dangerous or a lot more worrisome to actually have the wild type of these infections rather than getting the vaccines. I've put a few resources here for you to check out and look into about vaccines. And I'll leave that for you to look at. I just put in the first 12 months because I know a lot of parents panic when they see the first 12 months and how many vaccines, and everybody starts counting. Each one of those is 0.5 milliliter. If you have an ear infection, I do it by weight. I will give you 10 days worth of amoxicillin, which can be up to 300 milliliters at a time. So imagine that versus 0.5 milliliters. So, talk to us. And we can talk about why we do this. We keep forgetting why we started vaccines in the first place. Babies used to not a lot of babies made it to the first year of life, which is why we came up with these vaccines and why there are so many before the age of 12 months or by the age of 12 months. So it helps to kind of go back to the beginning of why we started all this. We are lucky not to remember and not to have ever seen things like epiglottitis, diphtheria. I think there was one case, now I forgot when. I think it was about 10 years ago in Europe. And it was the first case at the time in 35 years of diphtheria. And none of the new graduates have seen it. So I'm glad somebody picked it up and figured it out. And it was a non-vaccinated child, unfortunately. But think about it before you say you want to wait or you want to space it out. There were studies made for 100 years. We've had vaccines since 1902. The first one was in 1880 something. I can't believe I forgot that, but vaccines being promoted as something important have been since the 1900s. So we've been perfecting those over and over and over again. So now, venturing outside. Before COVID, it was sort of simple. If it's flu season, let's wait. Let's protect the baby, make sure everybody gets their flu vaccine because the baby can't get their flu vaccine until 6 months of age. Now with COVID, you want to be extra careful because you want to make sure that you don't want to run into somebody who's coughing, who's walking around with COVID that's asymptomatic. Thankfully, babies are not getting as sick as adults, and it's pretty rare in children and infants to end up in the ER because of COVID. I'm more worried about the parents and the grandparents from the babies to, giving them the infection. When you're home during the pandemic, especially the last years, we've seen a lot of anxiety, a lot of feelings of isolation, especially first-time parents. We still have a great support system, but most of it is through social media and TV and apps. But it is important to keep up with your family. And thankfully now people are getting more and more vaccinated. I think up to now, I just checked it right before, in Orange County, I think we have about 40% fully vaccinated with both doses. And about 58% have gotten the first dose of the adults. And now we're starting to vaccinate the 16-year-olds. So I hope life is going to be back to normal. Keeping that in mind and keeping your mind occupied, keeping yourself engaged with family and friends in whatever way you can. It doesn't replace face-to-face and actual contact with people, but as much as you can. I don't know if I have enough time, but I will go through that. Every hospital and every place has had to change their policies over and over again to accommodate what's going on with the community and with the COVID infections. Hoag has done a great job. We keep updating our policies to reflect what's going on, to protect our families and our patients and our staff, and we try to ease up on them and restrict as much as we need to based on what's happening. So I put a few things here, especially in terms of maternity and delivery and who's allowed and who's not allowed. There is one point I want to clarify. The laboring moms may have one significant other. It's that one is for a person who's going to stay with her and sleep overnight throughout the entire stay. But they are actually allowed 2 people during the delivery. And if they want a doula, they can have one too, on top of the 2 people during that delivery, but only in the labor process. Once it's postpartum, that doula that cannot stay. And if somebody needs to stay overnight, it has to be 1 person. And we recommend the 2 people that are going to be around that mom are from the same family, so that we know the exposure is the least amount as possible. The NICU allows at least 1 parent at a time to visit at one time. The idea is to try to minimize overcrowding in a small area with babies who are super sick, who are trying to recover. We do test any planned C-section before they arrive to admission, just like we do with any other procedure. If the mom shows up to be admitted for delivery because they're in labor and they look symptomatic, we are going to test them. We do have the rapid COVID testing capabilities, and I believe we're getting them very, very soon to our clinics as well, which is a great way. I believe our urgent care has the rapid one, but the pediatric offices I believe, as we speak, they're working on it. Moms with COVID, we do recommend separating the baby. We try very hard not to separate parents for moms and babies because we want that bonding process. But again, that changes here and there based on what's going on. And now that people are vaccinated, it might actually help us. Babies can still feed with breast milk. And moms, you can refuse if you don't want to separate from the baby. I would talk to your doctor. The deliveries, we still do not allow flower deliveries. Actually, there's a little update on the food one. It's actually back to no food deliveries outside the hospital or inside the hospital. Again, because we're trying to minimize the foot traffic in and out of the hospital. Sorry, I realized that because I tried to order something a couple of days ago when I was in the hospital visiting my dad, and I couldn't do it. But they do accommodate you when you're in the hospital. If you call the nutrition department, they will accommodate all guests because our cafeterias are closed, again, to minimize overcrowding and people being too many people in one spot. I know these precautions are unpleasant and they feel like they're a burden sometimes, but honestly, they are in place to prevent the transmission of COVID and to keep us as safe as possible so we can continue to do what we need to do for our patients and our families and keep our staff and our patients as safe as possible during this epidemic. But things will change. The main thing is don't delay your child's care. Everybody has been kind of cooped up and isolated and haven't shown up for the doctors, which is not a bad thing. And most of us haven't gotten sick, knock on wood, for a whole year. I haven't gotten a cold, so that was a plus. But we don't want to have the babies miss out on their vaccinations, on keeping their immune systems up to par, so that once things are progressing and we're back to being outside and with friends, we do expect babies to get sick here and there, as they should, but the more vaccines we have on board, the more protected they are, the less they're going to have to go through these things. Face coverings are still mandatory in our offices as of now, and again, things will change. The symptom screening and temperature checks, I put a little asterisk there. It depends on the offices, but most places we are still symptom screening, and we may not be doing the temperature checks on your forehead, but we are doing them. They are actually, I believe, what are they called, infrared, or above us. They're checking you as you walk through the door. The equipment in our clinics, every time before a patient walks in the room and every time the patient walks out of a room, we wipe things down, we sanitize everything, including our stethoscopes, our otoscopes and everything. We are still sort of staggering appointments to allow parents some social distancing so that we don't have too many people waiting to be seen. Some places are still separating sick from well visits, but again, that's also a little bit changing as we are vaccinating more and more people. Telemedicine visits have been wonderful. They're a great help. We still have them. We love doing them. If whatever we can do via telehealth, we will. So if you're worried at all and you don't want to come in, always ask if this specific visit that you're asking about, if we can do it as a tele visit, we will try our best. If it's something where we have to do a procedure or do a physical exam, like for a well baby, we have to have you in the office, of course. Whenever it's needed, we will fully gown up and do the full personal protective equipment by the staff and the physician for certain patients who come in with certain symptoms, because again, we're protecting ourselves and everyone else. And with that, I believe these are our beautiful offices at Hoag Medical Group. Feel free to come join us and visit us at any time. And I put some helpful resources when it comes to websites, apps, things that can help, books even, remember books? But the most important thing is be mindful. We're all on the internet 24/7 these days. We're getting a lot of our information from social media outlets, blogs, vlogs, and all these funky little names. And of course, family and friends are a great source of advice and helpful tips, but be very mindful when with all this information. Always ask, because some advice may be great, but it may not be the right thing for you, for the baby at that moment in time. So always ask. We're here. That's our job. Let us show you how much we know and how much we learned. And with that, I will stop. So I'm going to go ahead and check and see what questions we have. Oh, that's a great question. How do I choose a pediatrician for my child? And actually, I meant to talk about that a little bit, so I'm glad you asked. So one great thing to do is meet and greets. We love meet and greets. Basically, you want to look for somebody, of course, that's in your network. The best thing to do is schedule a meet and greet. You can do it in person, and this way we can show you the office. You can meet the staff, you can meet the doctors. You can even do it as a televisit if you want to just kind of talk to the doctor and get a feel of that personality of that doctor and see if you mesh together. There is nothing wrong with scheduling 10 visits with 10 different doctors from the same group. You're looking for someone that you're going to have a relationship for a long time. You're looking for someone who's going to have the same ideals that you're looking for, the same kind of thought process, somebody you can give and take with. You want someone that you're comfortable with, that has a personality that meshes with you. Just like any other thing that you do, you want to make sure you pick the right person for you. And there's nothing wrong with checking the doctor and saying, you know what, I don't like you, I'm going to try somebody else. That's fine. And it's the best time to do it is while you're getting ready for during pregnancy, when you're either getting ready to have a baby or getting ready to become a family. You're almost in the third trimester, that kind of thing. That would be great ways. You want to ask as many questions as possible. Especially things about vaccinations, about the visits, about do we offer televisits, are we able to communicate with the doctor via a secure channel on, for example, for us it's called MyChart, which is the patient portals. Those are important questions. Are we open late? Most of our offices, some of our offices are open late, and I believe we're expanding that as much as we can. And we have weekend clinics that are run by the same physicians that are the physicians of the regular everyday weekdays, which kind of helps a lot because this way you can see your doctor on a weekend if it happens to be that doctor's day. What do I do if a baby cries constantly? So babies will cry. Sometimes they'll cry a lot. Sometimes they'll be wonderful and they won't cry at all. Go through the steps. It could be hunger. Babies could have eaten 5 minutes ago and all of a sudden they want to eat again. It could be gas. It could be it's too hot, so check the temperature. If the baby's overwrapped, maybe they just want a little bit of space. They want to just move around. Maybe they want a little bit of tummy time. They could be trying to poop and they just want to grunt and cry and get it out. Some babies have colic. Colic, ooh, that's a tough one. But when it's true colic, the baby will cry at the same time, at the same day, for hours nonstop. It's blood-curdling screams. So just go through the checklist and talk to us again. It could be as simple as burping the baby or giving them more food. Should visitors be fully COVID vaccinated prior to meeting the baby? I'm a big fan of vaccines, as you can tell. So for me, absolutely. The reason is because not just for the baby, it's actually for the mom and the dad and the grandparents that are taking care of the baby. And just make sure they're vaccinated with all the other vaccines that we need, like the flu vaccine if it's flu season. The other thing is, how soon after birth can you circumcise the baby? The baby has to be at least 9 to 12 hours old, depending on who you ask. I usually wait till 12 hours. But the most important thing is, it's best to give them the vitamin K first, because they're going to bleed, and we need to make sure that we have the clotting agents available in the body and ready to go. The other thing is, they have to have passed their first urine. We need to make sure that system works. The plumbing has to work. But other than that, you can do it as early as that. We try to do it before the babies go home. Next question. After baby is born, I would like to have skin-to-skin time versus the baby given all the tests immediately after delivery. Is this something I need to ask in my birth plan? I would say yes, because this way they can actually explain to you the process and what happens before they give you the baby to put on the breast. These tests that I talked about, the bilirubin, the cardiac, the hearing screen, the metabolic screen, those are done throughout the visits, usually towards the end of the visits when you're ready to get discharged, either the day of or the night before. It's not immediately after birth. Immediately after birth, it's usually they're going to take the baby, wipe them down, check, do the APGAR scoring, clean the baby up a little bit, give them the eye ointment, the vitamin K, the hepatitis B, if you had accepted all of those, and then give you the baby right then and there after delivery. Put them on the breast, and then skin to skin, and you can even start breastfeeding. I hope that helped. But always ask ahead of time. It's always good to know. What are your suggestions for how to pump in addition to breastfeeding to allow for dad to be able to feed as well? Thank you. Dads have had a wonderful time, I want to say, take that with a grain of salt, because of COVID. They got to experience what it's like to be with the baby 24/7, and a lot of dads are loving it, and they are asking to be more and more involved. It's just kind of nice. You can pump. I always recommend talking to the lactation team to talk about when is the best time to start pumping, because we want the breast milk. And at some point you're going to be making a lot more than the baby needs, and you can start pumping and freezing and pumping and having dad have an experience, and mommy can take a little bit of a break. So. And then I have another question. Pump after feeding every time or certain times of the day? That's up to you, and it depends on how much supply you have and how engorged you feel and how much baby wants. So I would play it by ear, and again, these are all excellent questions to ask the lactation team when you're in the hospital. But again, I usually say go by how you're feeling and how the baby's doing and how the supply is going. Do you suggest we use a pacifier right after baby is delivered, or do we need a pacifier, or when do we need a pacifier? I'm not a big fan of pacifiers. Pacifiers are there for a reason. For, like, let's say it's a baby who is not sucking properly, needs a little bit more exercise, a premature baby who's working on suck reflex and trying to get it more mature. Yes, of course, we need the pacifier, and usually the feeding team is helping. For the first month or so, my feeling, honestly, is if you're going to put a pacifier in the baby's mouth, it should be milk, because the baby's sucking. He needs to feed. They're still growing, especially the first 2-3 weeks. They're going through that exponential growth. After that, you can use a pacifier, and then you run into the problem of, if you use the pacifier for too long, it can become a habit for the baby, and that's their security blanket or safety net, and it's hard to get them out of that, and that's going to be a problem if you're trying to go to daycare, but that's when they're older. If I see a baby holding a pacifier and they're 3 years old, I'm going to start talking to mommy. I'm a big fan. I usually talk to parents about around 15 to 18 months would be the best time to get rid of bottles and get rid of pacifiers, because by 18 months, it becomes sort of their safety net. And it's kind of harder to break the habit. The other thing is if you keep the pacifier for too long as the baby's growing, it actually interferes with how the teeth grow and how the shape of the face is. And you can get the buck teeth and the crooked teeth. And if you're using a bottle to sleep at night, that constant milk and sugar from the natural sugars from the milk are just drowning the mouth in milk, you're more likely to have cavities and what's called bottle rot. So if you don't need it, you don't need it. It's one less battle to fight, that's what I say. How can you ensure the baby gets enough breast milk if you are planning to breastfeed for 6 months? Go by how your breasts are feeling and how the baby's feeling. The other thing is you can start feeling over time, you'll start feeling the baby's getting heavier and the baby will be satisfied. I always tell parents use both breasts every time you're breastfeeding and go back and forth until the baby kind of decides I'm done and either falls asleep or pushes you away. When you have the baby on the breast, you can actually tell sometimes if the baby's kind of nibbling and kind of done eating and kind of like just playing around in a way. It could be because he's full. It could be because that breast is empty and they're waiting for it to fill up again. So that's when I tell parents, if you feel like the suck has changed and they're kind of getting a little lazy or some difference in the suck, flip him over, put him on the next breast and try again. If the baby starts sucking like crazy, you got it. That breast is full, he's still hungry, and so forth. It should be 10 to 15 minutes on each breast a couple of times. Do I have to get the Tdap vaccine before the baby is born? I am 29 weeks. We do recommend that you get the Tdap vaccine. We give it to pregnant women at every pregnancy. The reason behind that is some of that, it's mainly for the tetanus and the pertussis. Some of that vaccination will actually pass through to the baby and protect them in the first couple of months of life before they are due to start their vaccinations. So yes, the answer is yes. What bottle brands do you recommend? Ooh, that's a good one. It depends what you like. Honestly, for me, I went through a lot of them with my sister. I helped her a lot. I learned a lot from being an auntie, and none of that was in the book. So. But bottles was a big thing. We went through a lot of different bottles. Dr. Brown tends to be really good, especially for babies with reflux or who tend to swallow a lot of air. The other one I like is, I think it's called Avent, A-V-E-N-T, and Tommy T's. Those are my favorite three. But again, whichever one works for you. The Tommy T's and the Avent, the silicone is a little softer. It almost feels like it's the same as the breast. And one of them has this built-in thing. If the baby starts sucking too much air, the nipple will actually involute into the bottle, so you will have to reposition, which I found out is because I was doing it wrong, and now I know how to do it right. So, but ask friends, check them out. You can look at the reviews, and you can play it by ear and see how it goes. Hopefully you may not need the bottle, but if daddy's helping, that would be great. What vaccines do I need to get done before baby is born? This is my first baby and I'm 19 weeks. For flu season, it's the flu shot. The Tdap would be another one. COVID vaccine, that's a little COVID vaccine. We are in a pandemic, so we don't have a lot of data yet, but I would definitely talk to your obstetrician about that. A lot of women have gotten the vaccine and they are pregnant. Some of the studies that were done on people, some of the women have gotten pregnant during these studies, and so far it doesn't look like there's any long-term effects to the fetus. The more concerning issue is having COVID when you're pregnant, the actual disease. You are more likely to get sick. Pregnant women tend to get sicker than non-pregnant women when it comes to COVID infection. We have seen preterm delivery because of COVID infection, but not much so far as I know, as far as we know. Again, this is going to change, and I hate to leave it up in the air like that, but we are in a pandemic, and you kind of have to weigh the good and the bad. We want to protect the baby as much as possible. The mRNA vaccines is what these vaccines are. You are not getting the infection. mRNA vaccines is just we're giving you the mRNA piece, which is kind of like a recipe guide that the body will take and will make one of the proteins that we need to target in order to kill that virus before it actually causes the disease. It's called the spike protein. So what we're doing is giving you the recipe, and your body will make a little bit of that spike protein, and the body will look at it and will realize this is abnormal, will create all these antibodies against it, and will create memory cells, and that's how we prevent the infection of COVID. The mRNA itself is very fragile. It doesn't last very long, so it's unlikely to pass through into the breast milk. But some people do recommend when you want to get the COVID vaccine, wait until after the first trimester. Live vaccines, you have to do them before you get pregnant. Oh my goodness, please correct me if I'm wrong. You do have to do them before pregnancy, and when I say about 2 to 3 months before, I would have to double check that, but it has to be before or way after delivery. And last question, any recommendations for thermometers for a newborn? There's so many out there, and again, with my sister and her babies, we went through a lot. Braun is my favorite product because it's one of the best qualities, but you can do the forehead, you can do the axillary, you can do the one in the ear. The one that's the forehead or the temporal one tends to be more accurate than the one you put under the arm or in the ear, because those two actually have to do with technique as well. So you can falsely get it too low if you're not putting it properly into the ear, or if you're not putting it properly under the armpit. The most accurate one is the rectal temp. I'm not a big fan. Some people do like to use it for the first month or so. The new rectal temperature thermometers are a lot safer than the ones we used to grow up with, and they are too short. You cannot put them up there too far in, and they are very good. But most people, the easiest one is the temporal one. And that's about it. Thank you very much for joining me today, and hope you have a wonderful time. Congratulations on becoming mommies and daddies, and have a wonderful time. Hope to see you soon.